The Cancer Experience Registry is an online research survey for patients and caregivers going through the cancer experience. It collects information about the impact of the cancer, including direct and indirect costs of care, of transportation. It could be a communication with your healthcare team. Also, importantly, quality of life and unmet needs. Participants would answer multiple choice questions as well as a few open-ended short questions. The 2020 Cancer Experience Registry Report that came out that you referenced is our third release, and it contains high-level findings. And the report's made up of several sections. So in our general registry component, it's open to all cancer patients and captures a wide variety of issues that patients face, regardless of the nature of their disease. There's also a caregiver registry, and that's a separate set of questions that focuses on the unique needs that would impact anyone that's a family member or an informal caregiver to someone living with cancer. We also have a third component, which are 12 different specialty registries. They look at the unique experiences that a patient might have in that particular disease type. An example could be prostate cancer, breast cancer, or ovarian cancer in our tool. There's a lot of information in the registry. And so one of the areas that I wanted to share that I thought were really exciting and relevant to this conversation was relative to anxiety. So 49% of our registry participants were at risk for clinically significant anxiety. 4 out of 10 were at risk for clinically significant depression. Similarly, I referenced the caregiver registry a few moments ago. Caregivers reported anxiety at levels that are substantially worse than the national average at 49%. That's important because while some new clinical guidelines do talk about standards that patients are required for screening, some are looked at from a comprehensive perspective and some are not. And so by not providing this comprehensive psychosocial distress screening, looking at depression and anxiety, it means the care team could really be missing a lot of critical components to a patient's well-being and have an impact on their outcome.